Assalamu alaikum, the communication day. First scenario, you are asked to see a 64 years old lady in the respiratory outpatient clinic with the results of her staging CT. The patient was referred with a history of persistent cough unresponsive to the several courses of antibiotics. A chest X-ray requested by the general practitioner prior to the referral showed a probable mass in the right upper lobe. The CT confirmed the mass in the right upper lobe with mediastinal and subcarinal lymph nodes, a small pleural effusion with and multiple liver metastases. This has been discussed in the MDT multidisciplinary team. For the palliative, your task is to explain the multidisciplinary team outcome and address the concerns. Are you ready, Dr. Maida?
Yes, I'm ready.
Okay, here you go.
Okay. Can you hear me? Hello, my name is Dr. Maida, one of the medical doctors. Just can I confirm that you are Miss Lily, 64 years old?
That's right, Dr. Ham.
Hi, Miss Lily. Before we start, do you want anyone to attend this meeting with us?
No, I'm fine by myself.
Okay. Can I know, just I want to confirm that we are here to discuss the result of the CT scan you've been done. Can you tell me how far you know about your condition?
Oh, that's doctor, thank you. Well, for the past 2 months, I've been going to see the GP because I've been having this cough, but I've been persistent. And the GP have tried several antibiotics, and it seems I'm not getting quite good. So he did a X-ray, and he said it was a bit concerned, and he wanted me to come. So I've had a CT scan. So I'm here to discuss the CT scan really to know what exactly is going on.
Okay. Can I know, do you have any expectation about what may be the results of this scan?
No, I just want to know. There's nothing going through my mind, honestly. I just want to know yeah.
Do you concern about anything? Do you have any specific concern about what the result may be?
Well, because it's the lungs, it's my chest. I've been having this cough because my dad also had this cough. I also have a similar cough before he died, and he was told he has lung cancer. So I'm just worried. I don't think it is cancer, but there's just that kind of but I just think that could it be cancer? Because my dad also has similar things. So
I'm afraid the results that's shown in this CT scan is not as we hope. So the CT scan confirmed that there is a mass in the upper part of your right lung, and there are also this mass. Most probably, we think about cancer. I'm sorry to give you this bad news.
Doctor, are you telling me I've got cancer? No. Can you have a second look at the scan and tell me what it is? Just tell me something else that is not cancer.
I'm so sorry. I know it is very, it's not a good news to give you today, and I'm afraid this is what we find in the right lung, and this they also find that has been spread already to your lymph node. This is these small nodes in your body, and also to your liver.
Oh, dear.
I know it is hard news to be absorbed.
So I'm just going to die. Gosh.
I'm so sorry for that. I know this is hard news. Just we need to break it one by one, and we go through everything we can do and we can offer for you. It's not an easy one, but we need to deal with it.
So, doctor, what are you going to do for me?
Okay, I will go through what we can do for you for with everything, but first let me explain more about what we find and what does that mean. And we so as I told you, this CT scan confirmed this mass, and we think it is a cancer, and there is unfortunate spread to the lymph nodes and the liver. This suggests that we are dealing with type of cancer that has spread, and in clinical term, we call it metastatic lung cancer. Okay.
Doctor, it is what it is.
Yeah, I'm so sorry for that. It must be very difficult to hear. Would you like me to continue, or you want to take a moment?
Yeah, if you want to, really. I'm okay. Yeah. I'm
Okay,
just
so yeah, I know you are shocked. It's a really
Mhm.
shocking news I'm giving at the moment. And what happened when we find this in the CT scan? We've been discuss your case in a multidisciplinary team. This is we call an MDT. That's MDT with a lung specialist and cancer doctor with radiologist together. All of us, all of this MDT reviewed your situation, and given the extent of the spread of this cancer, we think treating this cancer with what we call palliative approach would be the most appropriate.
And what does that mean, doctor?
Okay, so palliative does not mean we are doing nothing. It means we will focus on relieving your symptoms, making you pain-free and helping you go through the symptoms of cancer. And we are concentrating at the moment on improving your quality of life and supporting you physically and emotionally.
So, doctor, what you mean now is I can't be treated. I can't be cured of this cancer.
Okay, so there is a many type of treatment at the moment we are offering. That type of treatment like chemotherapy, radiotherapy, and everything's to try to kill this cancer. We think that at the moment this is not in your best of interest, and we think that focusing on relieving your symptoms and improving your quality of life is more important at the moment. So we may be offered treatment like chemotherapy and radiotherapy, but this is not, we are not aiming for curing the symptoms, just we are aiming for reducing the symptoms of the cancer and to slow things down a little bit and make you feel more better.
Oh,
How does it
doctor.
sound to you?
Oh, God. It's a lot to take in right now. But I'm just thinking, what if the GP had referred me earlier than this? What if he has not been bombarding me with so much of antibiotics? There's a lot of what if going through my mind. Do you think it should have been curable instead of wasting my time at the practice? 2 months is a long time. It could have made a difference.
Mm-hmm. Um, to be honest with you, this is at the moment, I don't know what the situation at that time when your GB saw you, because the symptoms of infection is similar to what you are presented with. So it is difficult to distinguish between if it is a cancer or it is just it's just infection. Normally, what we do as the doctors, we try some antibiotic, and if this not and if your symptom is not responding at that time, we refer you for further investigations to find out if there is any underlying cause. And I think this is the exactly way your GB go through.
2 minutes
I'm not
left.
I'm not still quite satisfied. I still believe if the GP has referred me earlier, this might have been curable. And I think I want to let the GP know about this. I want to let him know so that no, I'm not just happy with that. You could have just referred me earlier. In fact, I want to lodge a complaint about the GP. The practice needs to be checked. You could just keep it for 2 months. Oh no.
I'm so sorry for that. I know you are suffered a lot, and I can't prevent you from complaining. This is your rights, and from the point of view at the moment, to be honest, I don't. We don't know exactly what the circumstances at that time. Uh, so let us at the moment focus for how to treat you and how we can go through this period of time. Do you think that we need to discuss another thing in another time if you want? I think I am giving you a lot of to take in.
Yes, doctor, I think so, but I'm just worried about my family. I don't know how to break this to them. I'm just worried. It's okay, doctor. It's
Yeah,
okay.
I know it is hard to do so. And regarding your family, anyone is depends on you. Do you have a kids?
Yes, I have. I have a 3-year-old. No,
Mm-hmm.
I have a 3-year-old grandchild that's still with me.
Mm-hmm, mm-hmm.
Mm-hmm.
Yeah. So what we can offer for you, that we can offer some support to you and to your family financially and socially, and we also, I know this is hard to you as well, so we can offer as well a psychological support, which is very important to you and to your family at the moment. And I will offer some. I will give you some written advices to go through, and um, I also I also can give you some website to read more about it, and if you have any questions to raise, I think it's a good time to just to call me, to call us, and we can arrange another meeting. Is that okay?
Thank you, doctor. Yeah.
Okay.
Yes,
Now, how you can go? Do you come alone, or do you need us to book a taxi for you?
I can sort that. I think I'll be fine. Thank you,
Okay.
doctor.
Thank you. Do you have any questions or concern you want to ask me?
No, Dr. Ford, I'm good. Thank you. It's
Thank
just what it is.
you. Okay. Uh, can I ask, what do you do for a living?
I'm retired. I just look after my grandchildren.
Mm-hmm. Mm-hmm. And how you have been supported, how you been supported financially, I mean.
I'm fine financially. I get support from Universal Credit and the likes. Yeah, I think I'm good financially.
Mm-hmm. Okay. And do you smoke?
Yes, doctor, I smoke. I smoke
Okay.
about 10 cigarettes a day. I've been smoking for the past 40 years.
Mm-hmm. Um, just quick one. Sometime, if you start to stop smoking, this I think may help the symptom of coughing, and it can help some relief of your some of the symptoms of coughing, and uh, it will be a good idea if you try. Do you think about it?
Yeah, I will.
Okay, so we can refer you to a smoking cessation clinic, so it can help to slow down the coughing and the symptoms you had, because the smoke in itself can affecting your symptoms. Does that sound good to you?
Yeah, it does. Thank you, doctor. It
Okay.
does.
Okay. Do we have time or the time up?
Actually, the time is up, but it's difficult to end such discussion and conversation. Really, it was amazing between you and her. She was professional actress, and you did a lot of efforts. So we can end the session now. Sorry, the scenario now, the discussion, and let's hear Dr. Ayula comment.
Well done. It was a good one. It was a good station. Dr. Maida, it was good. I like it. I felt good as a patient. So I think that's good. There was no point that like that kind of feeling like no, don't say this to me. There was no point that I felt that way. It was quite a good conversation. Your tone was good. You were calm all through the conversation, and I didn't pick at any point that you were using any jargon, so I was not able to pick anyone at that. You were empathic. You were sympathetic. Your sympathy was quite okay. I think it was a good one, I must say. It was a good one. You explained to me very well, quite understand that it has spread and it's palliative. Just that when you were saying that palliative thing, I think you spend a lot of time telling me what, though I think that's the part, that's one of the meat of the conversation, really. But I think that you may perhaps people have said something could have, like, say for instance, like, okay, the reason why we did the CT scan was to exclude, since the patient already had and the father already had cancer. I already told you that my father had cancer and I'm worried I might have cancer like my father. Then I think it's a good place to enter, like, oh yeah, you tried the CT scan mainly to exclude cancer. And the unfortunate result came back and it's not what we thought it is. And the way you break it was good. And we think it is called cancer. And unfortunately, it has spread. At that point, would have been the best time to say, unfortunately, just say it immediately. Unfortunately, this cancer has spread beyond the lungs. Instead of saying it and waiting for me to give you that emotion, then you came back and tell me again that it has spread. That's like giving me double something. Do you get? Yeah, just tell me immediately that it is cancer and unfortunately it has spread. Let me manage it together at once. Like, oh gosh, blah 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 blah. And what do you want to do for me? Do you want me to tell you more about this? Okay. It has been discussed at the MDT, and they think at this point the cancer is not curable. The cancer is not curable, but we will support you as much as we can. And we have a plan for you to give you palliative care. And then if you now want to know more about palliative, now explain that it's just a care that we do to ensure that you don't have any pain. If you have pain, we'll give you painkillers, respiratory, your breathing, we'll ensure you don't have difficulty with breathing, support you psychologically, support your family in as much as way that we can do. Yeah. Then we proceed with the allow the patient to, or the simulator to pour out emotion as much as you can. Then another place, I think when I said I wanted to lodge a formal complaint about the GP, you said you can't stop me from complaining, but you didn't tell me how do you want me to complain. In as much as you didn't tell me, you can't stop me from complaining. You need to guide me on how to complain. And I think at this point, just tell me that I think you need to discuss it with the GP, with the GP manager. Let the GP manager knows about your feeling about this, and you're not quite happy with this. Have a conversation with the GP, and GP manager should take it up from there. Just let me know. Just guide me. Just something to guide me on what I need to do. Since it's a GP, not in the hospital, complaint now that the patient is having. Yeah, I think that was it. Then the issue of smoking. You asked me so late that if it was in the main exam, I think the time will have been up before you talk about the smoking thing.
Concerned that I need to talk about it, but then I said it's okay to talk about it because it's the one of relieving of the symptoms and the things. But I was like, it's already spread and everything. So what the point? It's then I discussion in my head that it is the time to stop it just to help the symptoms.
Yes. Even if person have developed cancer, even if it has spread, you still need to tell them about smoke sickness and to stop smoking because it's relieve their symptoms. It will prevent them from having other forms of cancer. It's still beneficial to them. So it's okay to bring it up. I know at this point the patient is a bit emotional. You just say we could talk about this in your next appointment. Do you smoke? I smoke. Then okay, all right. Have you considered stop smoking? I think you should do. But we could have a comprehensive discussion about this in your next appointment. I've given you a lot of information today. Okay, just that's I think does it make sense in that way? I'm just thinking that you could just round it up in that manner, just so that you are thinking in that line of smoking as well. But I think altogether it's a good station. Well done, Dr. Maider.
Yeah, I agree with you, Dr. Ayula. She did great. She was amazing, actually. And I will just add some few comments, but doesn't mean that she didn't do great. Okay. The tune she started with, it was great. It showed like she's going to break bad news from the start, from the introduction. Since that time, it seems like she is going to break bad news. When she introduced someone to attend as well, it's very important this scenario. We have to invite someone to sit with this, with her. The next point I wanted to stress on, the way to break bad news once, it's better than make it in two pieces, as Dr. Ayula mentioned. So it's a cancer and it's spreading beyond the lung, as Dr. Ayula mentioned. So better than even explain the areas or the zones where the cancer reach. Doesn't matter if you say to the lymph node or to the liver, it's beyond the lung, means it's advanced cancer. Because if you mention lymph node, it might be as a jargon. By the way, apart from the jargons, you could get full mark, Dr. Maida. Try to minimize your jargon. You used CT many times, you use radiotherapy, chemotherapy. I agree to use all these words. In addition to that, you have to explain the meaning of this. So if you will say chemotherapy, it's a medication that can kill cancer cells. Radiotherapy, it's a medication or it's a way of management. You can be undergone some rays focused to the cancer cells to kill it, like this. Okay. CT scan, of course, you can say an image. At least explain it once, then you can use it again. MDT, I like when you mention MDT, it's one of the groups um, composed of, for example, lung doctor, the cancer doctor. Don't forget the Macmillan nurse. It's important in this team, okay? You can mention the MDT as abbreviation, then explain it, and next you can use it again. This is a way how to use a jargon or medical term, and you can repeat it after. So you can abbreviate it in front of her and have a deal with her. This is a team which is called MDT, and we are naming this team as MDT. Then next you can repeat whatever you want. Okay. The smoking, yes, supposed to ask earlier to give advice. The point of the GP, I like also when you said, uh, no, I agree to say, but it's not the way to answer this. Better to say first, I'm so sorry for your suffering. She gave you a hard time and long time suffering from going to the GP many times. You didn't feel sorry for that. At least feel sorry for her. I'm so sorry for your suffering, being visiting him many times. Actually, we have to have a chat with your GP to know exactly what was there. If she said, Doctor, is it real that the cancer may be different? You can give rationale about that. So the cancers might resemble or simulate any other infection, or the infection might simulate the cancer in the presentation, as you mentioned. But I believe not to say I wasn't there, it's a good option. So don't say I wasn't there, I don't know about your situation. It means that you are taking out your responsibility. It's not good in the communication, okay? You have to share with her the feelings because she's feeling now this. Of course, she is depressed. So you have to feel sorry for her, to say sorry again, and try to have a chat with your GP and to know what exactly happened. And if she is insisting to be visiting or to complain, as Dr. Ayula said, you have to guide her. Sometimes they need from you to say what the solution, how you can help this surrogate or this patient. So you have to offer her the solution, even once. So you will visit the GP manager, or you can say, I will refer you to the office responsible, whatever, but give her the option. Don't leave her to go here and there. Okay. The smoking, I agree. The support, I agree as well to give. And the palliative itself. This is the task. I agree to spend some time to explain about palliative, Dr. Ayula. Even she will take 2 3 minutes. This is the task. She should fulfill the time to explain what is the palliative management. And I like when she said there is the option called palliative, in which we will treat your symptoms. Instead, we will not treat the cancer. Okay. The other thing, we will be sure that you don't have pain. And I like much when she said you will have good quality of life in the coming days. It's very important to mention those sentences. Okay, so the symptoms, treatment of management of the symptoms, socially and emotionally. It's important to mention emotionally here. This patient is shocked now by this news, so you have to support her emotionally. Even you can refer her to the team, which is mood doctors. She might be depressed in the coming days. Adding to them the quality of your life in the coming days. The option of palliative, I agree to say three of them: chemotherapy, radiotherapy, even sometimes surgery. However, according to your nature of the cancer, we will decide this in the next meeting, but we'll be sure that you will not suffer more. This is the summary of this scenario. It was great. Even the acting way of Dr. Ayula make it like a real scenario, really. It's amazing station between Dr. Maida and Dr. Ayula. Thank you, both of you. Any question before ending and moving next? Any question, Dr. Mayada?
No, thank you.
Yeah, most welcome. You can post your scenario to Dr. Ayula. Then we will have discussion, open discussion. Anyone want to add? Any suggestion? Any missed point? So the task here is palliative therapy plus breaking bad news, or breaking bad news plus chemotherapy. Sorry, the palliative therapy. Support, of course, you have to offer, and the smoking and social and job, occupational. Okay. Yeah, your scenario, Dr. Ayula. You are the you are the doctor in neurology outpatient clinic. Your role, you are the medical registrar actor role. The surrogate patient is Jane, Miss Jane, yes, Williams, 29 years old, teacher, candidate, task. You are asked to speak to Miss Williams, who had an MRI scan and a lumbar puncture last week. The result suggests she has multiple sclerosis. Sorry. She has, or the result suggests she has multiple sclerosis. Your task is to explain the diagnosis to patient in clear terms, address any concerns she might have, offer initial advice and support. Okay, Dr. Janaida, Dr. Ayla, sorry.
Yeah, okay. I'm just trying
Okay,
to, I'm looking
two
at the
minutes, then I will
questions.
start. Just give me a second to answer this. I have a receiving phone. Okay, I'm receiving call. Then I will be back. Sorry, Dr. Ayla, you ready?
Yep.
Okay, I will answer first the question from Dr. Rabia. She asked about the advanced directive in this scenario. I agree, you can ask. However, if you have the time, you can do it. if you don't expect this patient will have any expectation or she will illuminate or she's expecting like she will die even soon or later. So again, it depends on the scenario, the discussion, but it's one of the points you can raise it by asking, have you ever think about the steps of management or a medical treatment? So it would be discussed again in another meeting if you are preferring to be managed with certain or specific way. Okay. But I don't believe you have the time to ask this question if you fulfill the time for the palliative and the breaking bad news earlier. But it's one of the possible point to be raised. Okay. Thank you, Dr. Rabia, for the remind. Dr. Maidan, not yet. I will discuss this later in another meeting. I agree, yes. So you can raise it, but you can give it an option to be discussed in details in coming meetings. Why? Because you will offer her a lot of options like chemo or radio. She might tell you, doctor, I don't prefer to be undergoing this management plan or that management plan. I want to be free only of pain. So it would be managed or it would be discussed in another meeting. But if you open it in details, you might miss the social, you might miss the occupational, you might miss the smoking and alcohol. Okay. Next scenario, we can start, Dr. Ayula.
Yes, okay.
Yeah. Here you go.
Okay. Hello.
Hi, hello.
Hi, my name is Dr. Ayola. I'm one of the doctor. I'm one of the doctors here in the nerves clinic. Can I hi, can I confirm you are Miss Jane Williams, 29-year-old?
Yes, doctor.
All right, and is it okay if I call you Jane?
Yes.
All right, Jane. Yeah, I have an update for you about your health. Okay, we're here to discuss about your health. But before we proceed, Jane, could you tell me what you what understanding do you have about your health?
Yes, doctor. Recently, I have some issues with my vision and everything they need. So I came to, and sometimes some symptoms, weird one. My doctor offered me he said called lumbar puncture. He just put a needle on my back, and he did some scans to my I don't know the results of that scans and everything. So I'm waiting to find out what's going on.
Okay, and that's why we are here to discuss the results of this test that you've done. By the way, James, are you okay? Do you think do you want someone to be with you in this meeting today?
No, I think I'm okay.
All right, Jen. Okay. And do you still have those symptoms, those height issues? Do you still have them now?
At the moment, all of them resolved completely. I feel okay. I'm back to my normal.
All right. Okay. So we had this. You had a scan of your head, a special scan of your head, and also a test that involved putting a needle to your back to take some fluid from your head. This is to aim to make a diagnosis of what is happening to you. Usually, that is what we do in such situation. And Jane, unfortunately, I don't have I don't have a good news about this.
Mm-hmm.
Okay, it has come back and it shows a condition that is called multiple sclerosis. Have you heard about that before?
No.
Okay. Or do you want me to tell you about it, Jane?
Yes, please.
Okay, all right. It's a condition that affects the brain and the nerve cord and the spinal cord as well, I mean to say. And it's occur when there is a dysfunction in the defense system of the body and they start to affect the tissue of the brain and the nerves. And that are usually patients start to present with eye symptoms, body weakness, and sometimes difficulty with swallowing, which is what has happened in your own case, Jane.
Yeah, is it serious? Is it a serious condition?
Oh, Jane, I'm afraid that to tell you that it might be a serious condition. It could be a serious condition, but not to worry. If it could be a serious condition, and this is because it's a condition that comes and goes. Like you said, you don't have the symptoms right now. So during the active period of the when you were having the symptoms, if this is not well managed at that time, it could get worsened but not to worry, we'll keep an eye on you. And if at any time if you develop any of the symptoms of high symptoms, weakness of the body, you could present to the hospital and we'll manage you appropriately.
Doctor, I'm really concerned. Is it serious? I mean, something like a cancer or what it is? I'm just 29 and still not start my family yet. I'm planning to get married and I'm worried. What it is? I never heard about it.
Yeah. I know at this point is a lot going through your mind, and giving you this information, uh, it's a difficult conversation really to have, but knowing that it is something that could be serious, but like I said to you, we will keep monitoring you, we'll keep assessing you, regular follow up in clinic, and if there's need to intervene at any time, we will do that, and then we can. In terms of you getting married, it's then. By the way, could I ask you, Jane, do you plan to have kids?
Yes, doctor.
Yeah, okay. This is because if you need to have kids, we need to we need to it needs to be a planned pregnancy, and we need to refer you to to the woman doctor who will further assess you, because at some point you will need to be on steroid, and this needs to be planned, to be a planned pregnancy really, because during the pregnancy, though symptoms might get better during pregnancy, but after pregnancy it could get worsened. So it's okay to get pregnancy, but to get pregnant, I mean, but you will be monitored closely by the woman doctor as well as us in this neurology clinic. Are you all right, James? Does that sound like a plan to you?
Yes, doctors. I totally agree that I'm gonna go to the women doctor if I plan to get pregnant. But my concern about that, because I didn't take it, you said that it's just something affecting my nerve cable and it's affecting, that's why I have these symptoms. And I think as far as it's completely resolved, it didn't sound to me something serious. But at the same time, you said that it's serious, so I'm like confused.
Yeah, Jane. Like, yeah, it could. I'm sorry that you seems not to quite get this, but we'll take time to explain this again. Um, this condition is a serious condition because it's a condition that comes and goes. Okay, like you said, that at a point you have the eye symptoms, eye issue, that is the period that you are having the symptoms. And oftentimes this gets resolved on its own. And most times people who have this condition don't usually they don't have symptoms. They live their normal life as they could. But once the symptoms comes in, we need to intervene as much as possible, as soon as possible, to prevent to prevent further progression of this disease, and that we could come in with some steroid. We could give you some steroid, and that would be through the vein through the blood pipe. When this happen, that's what we're gonna do for you. But this condition, oftentimes people with this condition have gone ahead to live their life as normal as possible. Okay, but there is still some risks that they could come down with some progression, like blindness, weakness in their body, bladder issue. But this is not quite common. Most of them go ahead to live their life as normal as possible. How does that sound to you, Jane?
Yeah, I understand. But you mentioned a steroids, and so I heard about it because my mom was treating with this medication, and it is really this medication really afraid me because my mom developed diabetes in the at the end.
Oh, I see. I'm
2
sorry
minutes left.
about your mom situation. But if anyone is on steroid, we monitor them closely. We monitor their blood sugar because apart from diabetes, it could also give other side effects like blood pressure, weight gain, but things can. But we'll keep monitoring you in clinic as much as we can. And you will not be on steroid at all times. It will be when you have the active condition. So we'll keep monitoring you if you need to be on steroid, we'll monitor your blood sugar, we'll monitor your blood pressure regularly, and if there's need to intervene, we will surely intervene. And apart from this, we will support if there are other support that you might need, like physiotherapy, referring to the eye doctor. If you have to, we'll do all of this for you, Jane.
But now I afraid I will end in a wheelchair.
Yeah, I can't see your concern are quite valid, Jane. May I ask you, why do you think you will head in a wheelchair?
Because this is what I understand from your conversations, that it can cause a weakness.
Well, Jane, not there's a possibility that people can end up in a wheelchair. People with this condition can help in a wheelchair, but a quite significant number of them live their life as normal as possible. It's just a small number of them that could end up in a wheelchair. But we will keep monitoring you as much as in the clinic as much as we can. Okay, Jane.
Yes.
Yeah.
Yes.
Do you have any concern at this point?
Just some concern that it sounds to me something unpredictable. So what do you think? I will go through this, I mean, go through wheelchair and everything, or my condition is more better? I am in which side?
Well, at this point, it's difficult to say which side that you are. Okay, and I know that you might be having this thought. I mean, this thought might be going through your mind. But I want to assure you that about significant number of people live their life as high as 85% of them live their life as normal as they can, and they don't go down with complications.
Okay.
Okay, Jane.
Yeah.
Okay, I will give you some materials to go about, some leaflets, and our specialist nurse also have a chat with you today before you go, and then we would see you again in clinic and as soon as possible. Okay.
Okay.
Okay, Jane, has this have could you tell me what you are? I can see from your note that you are a teacher. Has this affected you in any ways?
I think when my eye affected, it was affecting me a lot, and I'm taking a lot of leaves, and it's affecting my job. I'm not concerned about the job and my near marriage and everything.
Not to worry. I think in terms of your job, we can see what we can refer to the occupational therapy to see if there's any adjustment that can be done to your job and see if there's any support that is available for you. Okay, and it's a lot. It's a lot to talk about, really. And I think we can have other conversations other time and in other clinic. And in terms of your marriage, the more concern is that when you are ready to start your own family, we would support you as much as possible in conjunction with the women doctor. Okay, Jane.
Yeah.
Thank you for coming to see us today.
Dr. Ayula, if I add 10 seconds only to advise or to ask about something very important, 10 seconds.
First, second, something about something important.
Yeah, very
Family,
important.
diet.
No.
What could it be? I'm not sure.
Do you think driving is important here?
Driving, yeah.
Yeah. Okay.
Because of vision, yeah.
Yeah, perfect. Okay. Consider time's up. Already 2 minutes extra added. I'm usually adding the minutes to add more concern and to understand how to address the concern. So as long as the discussion and the conversation is helpful, informative, I will let it added more minutes. Okay, so in order to learn more by this discussion, as long as it was great discussion. So let's start the comment from Dr. Maida, please.
Well done. Um, yeah, it's. I think overall it was good. The only thing that I was a little bit concerned about the how you describe this disease for the patient. If maybe I didn't hear it, but I didn't hear that its immune system is taken attacking the protect. I felt like if you go through that, its immune system is taken attacking the protective layer of the nerves. So you will she will understand the mechanism of the disease and so I will not keep asking the same question what it is. So it is we know what it is immune system. So and the way it take not predictable. And I feel if you can give some hope for this patient, because at the end of the day, MS it is a serious disease, but it's also treatable one, and the prognosis of it is not curable, but we can at least reduce the number of relapse. So the main part of the treatment is to reduce the number of relapse and to manage the symptoms. This is the aim of our treatment, and it is we you ensure that it is a difficult situation, but sometimes people you can give her the hope also. It's some people may find mild symptoms and some maybe need support at the end. So if you give these variations, it may raise some hope in this lady because she's just 29, and if she's mainly concerned about marriage, and you address that well, that the main issue is for this lady first, I think the marriage itself, because she's young and she may concern that she may need to talk to her partner about what will happen, and the partner need to be involved in this situation. If you can offer that, what you concern mainly, yeah, I think if you ask the patient what concern you mainly about the marriage itself, is it because you want let the patient explain why she's concerned. Don't offer directly that she's concerned about pregnancy. Maybe the marriage itself is a concern for her. So if you ask what concerning you in the marriage, so I will tell you that I'm concerned that I need to let my partner know about it, and I'm afraid he leaves me if he knows that I may get in a wheelchair. And so you give her a time and explore exactly what concerning this patient, but you directly offer that regarding the pregnancy, and you understand what I mean. And then regarding the other thing, I think you support well. Regarding the she's a teacher, and this is affecting during the relapse and remission course. Is still, I think you can say that if we are in a point that you can't manage or you can't do your work as normal, maybe we need to readjust your place by asking the occupational team to support you in that at that time, but I think it's early now, as the symptoms still like relapsing and remission, and now she's free of anything. Still, she can do her job as a teacher, but in a point, if we are at that point where you can't do your job, at that time we can discuss this with the occupational therapist, and we'll see the adjustment we can do at that moment. But you need to try, and I think also you need to refer this patient to neurologist, and you tell her specifically you need to be referred to the neurologist, a specialized doctor in this disease, and they will follow with you. Uh, Support group, if you can offer her support group, uh, so you can understand more about your disease. Uh, and then if you offer, if she need any family member in the future appointment to attend, uh, this is also will give a relief to this patient about her marriage, because she may need you to talk to the partner, and you help her to break this news for him. Uh, and then you can offer, I think you offer at the end that we can talk, this is because this is overwhelming information for a young lady. If you offer another meeting, a nearby meeting, after that will to simplify the things more, and take it from there. Uh, but generally, you did very well. This is what I'm thinking.
Yeah, I agree. She did in general well. So let's me comment as a counsel or counseling about a disease. What you mentioned already is perfect, Dr. Maida. You want just to repeat how to learn from this scenario, and I will mention every point how Dr. Ayula did and what she missed. Okay, so the introduction as agenda, yes, she did great. She asked the expectation, and you can ask how do you feel. It's a good question because she's worried about her result. Okay, then the most important here, the breaking bad news. Multiple sclerosis is one of the disease you have to break as bad news. Why? It has, yeah, it has sometimes which is good prognostic, but there is also other types which is poor prognostic. In general, most of the patient will have relapses, and some of them they will have or they will end up with wheelchair bound, right? So breaking bad news is important here. It affects the vision. Before we'll say the manifestation, let's say the definition. As Dr. Maida said, it's an autoimmune disease. You can mention autoimmune disease, but you have to explain in non-medical way what the meaning of autoimmune disease. So your defense system attacking your sheath or your covering sheath of the nerve cables in your brain and in your back, the major nerve cable in your back, and your nerve cable of your eyes. Why I specify the eyes? Because there is specific manifestation related to the eyes as a manifestation of the disease. So the brain, some areas in the brain, major nerve cable in the back, and the nerve cable of the eye, particularly the nerve covering or the covering sheath. Yeah, this is what happened, right? Okay. The next thing, the manifestation of the disease. You can mention whatever you want, starting from the very simple manifestation, like feeling numbness or weak sometimes. You can say vision affection, double vision, weakness uh, while watching, some bladder problem, your control, the control over your bladder or the water work, and you have to specify the most serious complication in this scenario. As simple as you explain, you have also to mention the most dangerous and the most serious one, which is, of course, bedbound or wheelchair bound, or even bedbound. Yes, you might be disabled to move at one day. There is possibility. It's not big percentage, but there is possibility. Okay, so don't give false hope and then give also hope. So there is possibility to be disabled. This is the most serious complication might happen. Okay, back to the manifestation already mentioned, the complication, the most serious one, the management plan. How you manage? As you mentioned, one of the management plan called steroids, and you cover this point well. It's one of the important point you have to manage and to give her some time to know about steroid as one of the options. But as you said, it's not for the long term. If she's worried about steroid, you can reassure her it would be high dose, yes, but for short time. We will take care of that. We will let you know about the possible complication, and we will let you under follow up to prevent the complication because it might happen for even from high dose short duration. But the medication, the options of medication nowadays is varied. We have some medication you can be given as oral. You can receive medication through under the skin. You can receive medication through the blood channel. This is what's called pharmacological options. If you have time and she raised one of the medication, you can explain. Otherwise, it's not the task here. The important thing is the non-pharmacological option. So the occupational therapist, they can come to you to help you at home, to arrange your home, to make everything adaptive and easy to adapt with during stay at home. The second thing, the job. You are unable to do your job, yes, we can reallocate you in easy job, office job to sit and not to be suffering. The next point, important here, the pregnancy and the plan of pregnancy and the children she might raise and the driving. Then smoking and alcohol, and give her some leaflet brochure. You can also arrange another meeting to explain more about the disease or the option of management plan. Okay, this is the way how to do in simple way. Always start with the definition, pathology, manifestation, complication, management plan. Of course, you have the investigation already diagnosed with the investigation. If you don't have the investigation and they are talking about further investigation, you will talk about the investigation. But since it is done, so no need to explain or to go through it. Okay. Any question, Dr. Ayula, Dr. Maida?
Yeah, thank you, Dr. Bassem.
Yeah.
In this situation, the patient is being seen in the neurology clinic, and we're just making the diagnosis of MS. Does it need to be referred to the multidisciplinary team?
For what? Sorry?
Multidisciplinary team, the MDT meeting for discussion at this point, will she benefit?
MDT will not be as a physician.
Mm.
So you can add to the neurologist, the ophthalmologist, which is also not a major task here. But the most important here, the occupational therapist, they might support her with any tools she might need in the future. The social support, the physiotherapy. Some of those patients will have stiffness and they need to be under a physiotherapy follow-up, right?
Okay.
For limb physiotherapy. So these are the team members, which is important apart from the neurologist. Okay,
Yes.
clear? Yeah. Any other question?
Yes, Dr. Basim, do I need to talk about the preventive medication for MS?
Preventing?
Yes,
What do you mean by preventing medication?
for attack. This
Baclofen?
yes, nitalimazumab and this
No,
drug.
this is not preventing. This is the management plan. This is the pharmacological option. Yes, I mentioned if you have time, you can give her options, but not by names. Unless it was written outside, you have to explain about, for example, natizumab or fingolimod, whatever the medication. But this is not the topic. The task here is to explain the disease. So the options, yeah, there is some options, but don't give the names. Otherwise, she will ask you more about the questions about the medication what about this medication? What about this medication? And it will take from the time of other task, which is, for example, support or the smoking or the driving or the pregnancy. Okay.
Okay. Okay.
Yeah, well done. So uh, we have Dr. Rabia, which is our luck today. She's the neurologist consultant. I hope she can add if she had something to add. Dr. Rabia, if you are free, please. Anything we can add to this scenario? If you can hear us. Dr. Rabia? Okay, maybe she's busy. Any question from others?
Dr. Bassem,
Yes,
what's the good answer?
Dr. Hadi.
The patient refused to inform her partner about the disease.
Perfect
This is her
question.
right?
His right. You mean not her right? You mean this, or you mean her right to inform or not?
No, she's
Yeah, you mean
not informed.
confidentiality. Yeah, not to inform. Yes, this is confidentiality. So this is her right. It's not his right to know. Okay, this is the patient confidentiality. If she want him to know, and she's afraid he will know and he will leave her, this is our job now. We can arrange a meeting with our specialized team, social team, to have a meeting with your husband and to break this news in pieces to him in order to have his support to her, which is very important because she will need him. And we can reassure him that she can live near normal life with him without leaving her. Clear? So it's her confidentiality and her right to decide if she want to give him this news or no. But our job is to deliver this news or to help her to deliver the news to his husband or her partner in another meeting. Why? Because she need his support. Those people, they can live near normal life, but they will need a lot of support, social, emotional, even the family support, right? So this is not the time to hide, and in the same time we cannot say to her, no, don't tell him. If you tell, he will leave you. Instead, we can convince the partner to stay with her more, to give her the support. Okay, you got it.
Yes, okay, thank you.
Thank you too. Any
Assalamu
other?
alaikum.
Walaikum salam. Yes, Dr. Rabia,
Dr.
thank
Bassem,
you.
how are you?
Yeah, I called you many times.
Yeah,
Yes,
no, I was there, but there was some issue in the connection,
it's
so I could not
okay.
answer it.
Yeah, the mic with you now. This
Yeah,
is
Dr.
your topic.
Fatim, I heard all the discussion about the multiple sclerosis. There's nothing new to add because the disease itself has got a good prognosis if you treat it on time. That's why I think in this communication, the only concern which will come up is, am I going to die? Am I going to become bedbound? Am I going to be dependent on other people? So the answer is very clear. As soon as we treat it, 90% people live up to a normal life without any dependence. Okay, but you do, but if you will not take the medication on time, or if you will forget the medication, you might have some relapses or attacks which can cause you to have a substantial type of disability. So the important thing is to enhance on the medication on time management, and if any relapse occurs to you, you have to come to the hospital immediately. Don't ignore any of your symptoms. Otherwise the prognosis is like a normal person. Okay, it's a very good prognosis disease. However, in 10% of the cases, the relapses are very severe and patient can become bedbound, because you have to tell him the bad side also, but don't
Yeah.
enhance on the bad side too much, because they usually cut your marks in communication if you're going to give negative features more as compared to the positive features. This is what my
Yes.
experience says. Okay, so be positive, but do tell them about some negative effects also. And this is going to be the major concerns in this scenario.
Perfect. Yeah. Thank you, Dr. Rabia. Shall we tell her about the types? Because there is
No, no,
types which is
no
progressive.
needed.
No,
No
not
need.
about the types by names. I mean
Hmm.
for the prognostic type. Because we don't
Uh,
know yet about her type.
Right, right, right. This is what I'm saying, Dr. Basan, because you have to tell him some in some cases,
Mm-hmm.
10% of the cases, the relapses are very severe and it can cause you to become bedbound. But 90% of the cases, they do come in attacks. However, if you are treated on time, you can live to a normal life without dependence. So
Perfect.
that's what I wanted to say, because relapse and remitting has got a good prognosis if you treat on
Yes.
time, if you take your medication. But if it's primary progressive or
Mm.
secondary progressive, which is usually 10% cases, it has got a bad prognosis. I do agree.
Perfect. Yeah, perfect. It's clear now. Thank you, Dr. Rabia. Thank you.
Yeah.
We are lucky to have you today for the target
No, no,
topic
no,
in the
no.
neurology. Really,
I think that means when breaking this is not bad news. It will be just telling about diagnosis.
but
Actually, all diseases are supposed to be breaking bad news if they are lot. For example, SLE. If you tell anybody
yeah,
about SLE, it's kind of a breaking bad news. But SLE is a controllable condition, and people do live a normal life. Okay, so you have to tell them the positive effects of the disease rather than the negative
No, I
side of
mean
the disease.
the process that the news is not as we hope and everything. I will tell it is bad news. Whatever we do, like any disease is bad news, but not in the process of a bad news,
let,
like some
let's
killing diseases.
if you let me answer this point, Dr. Maida, sorry, Dr. Rabia, any
Please.
disease having long-standing or long-term or lifelong manifestation which can comes and goes, it's considered as breaking bad news. No one will live enjoyed and his life will be fun if he's having such kind of disease, right? So it's a kind of bad news. This is my opinion. Usually, even diabetes, hypertension, yeah, it's controllable disease, but it's not curable disease. So how can I say it in a good way? This is my opinion about breaking bad news. Any long-standing disease, lifelong disease, or disease might be progressive, or disease might be complicated, and it might uh, end the life. So I can say it in bad news or breaking bad news way. Clear, Dr. Maida? Any question?
I think okay.
Yeah,
Uh,
yeah. Go ahead, go ahead.
yeah,
Let's discuss what you want to say. Feel
yeah.
free.
I think in this case, for me, like I will tell about it is a disease and everything, but I will not go through uh, giving like
Warning shot, you mean, and yeah,
warning
golden silence.
things. No, no, I will not go through this, but I try to like you test results. Like I will say, like your test results suggests you have a condition called whatever MS. It is a long-term condition that it affects your brain and spinal cord. And I will go through this. It is. I will tell that it is a long-term condition and everything, but I will not give a warning shot and whatever it is regarding the treatment and prognosis. It can be cured, but it can't be cured, but can be reduced and can be reduced and can be controlled. There is a variation in this disease. It can be very mild, and there is extremities.
Exactly. So you don't
I
know
will
the
tell
type.
the news, but I will not take the process of
Okay,
breaking bad news.
it's okay. You want to follow which approach? It's okay. But you till now you don't know that which type this patient is having. So you don't have any guarantee that this patient is having the good prognostic type. She might be one of the 10%, which is secondary progressive, for example, and she will blame you. You'll give me false hope that I will live near normal life. I will not have any manifestation or complication. I will not be bedbound. So be honest, as Dr. Rabia said, you can give the good news and you can give also the most serious and bad manifestation of the disease. Although it's not the most common, but it might happen. And you will be unlucky if you have this patient with this type, which is very few percent. This is my opinion in any disease which carry types or some of the bad prognostic factor. Anyway, we are in a situation you don't know what the exam even mood. You might say something good and the examiner give you good marks, or you might have tough examiner even you do good, he might give you tough marks. So it depends in your luck, in your examiner, in your situation, in your scenario. But we are trying our best. Okay. For me, I will do it as breaking bad news. You might do it in another way and you might get the marks. You might do it in breaking bad news. They might minus you. It depends again on your luck that day. Okay, but don't do the fatal mistakes. This is always the rule and the lesson. Don't say something can make the surrogate disappointed and you have good prognosis, for example. Particularly if they give you the type, for example, if they mention to you this is the relapsing remitting one. So you cannot say it's a poor prognostic one. So you can give him the good hope. It's not false hope, right? The relapse remitting one of the good prognostic one. So whatever you mention the good, so it's not false hope. Clear, Dr. Maida? Always be neutral and don't be as bad or as good as. But,
Yes.
but be honest. Okay?
Mm.
Follow your
Okay.
sense. Yeah, follow your sense.
Mm.
Depends on the scenario, depend on the surrogate, depend on the examiner. Hopefully you will have good situation and good scenarios. Okay, any other question you want to ask?
Dr. Bassem, please.
Yes.
What about the driving? It will not stop driving, right?
No, how come?
No,
What do you think?
only we no. If the
If
symptoms
she
not
doesn't
affect
have,
the
you mean,
vision,
yeah. If she doesn't have vision problem, yes, of course, yes. But if
only
she
we will
has,
ask her about driving. Okay,
yeah, if she has one of the symptoms or vision problem, you might refer her to the DVLA.
DVLA.
Yeah, but if
Mhm.
she said no, I didn't have, so you will be following with the DVLA.
But we will ask her about driving. Just
Yes,
asking.
yes, you have to
Mhm,
ask her.
mhm. There is a Dr. Bassem scenario. I don't know if it's old about a medical student diagnosed by MS and he planned
Mm-hmm.
to be a surgeon. I don't know if you
I
heard
know.
about this.
Yeah, I know
Yeah.
this scenario. Yes. So what do you think? How to convince her?
I think the same way that if the symptoms it's
Yeah,
affecting your job or
yeah,
something.
exactly.
Mm,
So at least, if she is even having these symptoms, you can tell her still you can continue your job and you appreciate her career and appreciate her responsibility, how she's caring about this job. And you can give her one option, which is good. You can still teaching your students how they can do the surgery, even for online session, even observing them while doing the surgery. She will not share by her hands, but she can share with her opinion, right? So you help her not to leave the job. At the same time, you appreciate
but
her effort. You got it?
but not advise her, yeah, but not advise him or her about that. Maybe you can change your mind or the
No, no, no. She
change the
she
plan to be
loves.
a surgeon. Mm.
No, no.
Yeah,
If she loves it,
I heard
and she
about this
told me,
scenario. Love.
yeah,
Mm.
I love this job. I wanted to do that. So you can do while supervising others. You can teach them online. You can teach them even without sharing the surgery itself. Why? Because she might hurt the patient. She might do harm, right? So you cannot share by your hands because you have some weakness, but you might share with them your opinion, teaching them how
Yeah,
to do them.
but not advise her if you have the symptom, or maybe we can you can assess your possibility to do, and then if you have any problem in your hands or something to not do, or
If she's
I'm
able
not
to,
remember exactly. Yeah.
yeah, if she's able to do, she doesn't have any weakness, she can practice
Mhm.
it. But if she has weakness, because it's on and
Because this
off.
one attack, yes, maybe it's
Exactly,
the
yeah,
attack come in any time, right?
exactly. But if she feel it, she can stop it.
Yes.
Okay, and you can appreciate it if she can do it while teaching them. So she can share the opinion without practicing the surgery itself. If she has symptoms free, she can practice it.
Yes.
Yeah,
Yeah, thank you, Doctor.
good question to be raised. Thank you too. Okay, any other question before ending the session? Dr. Mayada, Dr. Ayula?
No,
No,
thank you.
Thank you very much.
Yeah, thank you to, as usual, your sessions and your performance, both of you, really, it's amazing. Hopefully, before ending the session, I will ask again, anyone has question, any comment, any missed, any doubt? Dr. Aisha, anyone want to add comment, please feel free. Okay, if no questions, we can end the session. Wish you a nice weekend. See you on Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.